You know what really gets me fired up? When I see perfectly healthy seniors walk into a medical office feeling great and walk out terrified because their doctor just scheduled them for a battery of tests they're calling absolutely mandatory. I'm talking about tests that, according to the latest medical research, might actually do more damage than good for folks over 70 who are living their best lives. Now, I need you to stay with me here because what I'm about to share could literally change everything about how you approach your healthcare in your golden years. This isn't about conspiracy theories or rejecting medicine. This is about understanding what the science actually tells us versus what's become routine simply because it's profitable. And trust me, after nearly 3 decades working with older adults, I've seen both sides of this coin more times than I care to count. Let me paint you a picture that probably sounds familiar. You're 73 years old. You're gardening, walking with friends, maybe even traveling. You feel fantastic. Then you go for your annual checkup and suddenly your doctor is rattling off a list of tests you absolutely must have. Colonoscopy, cancer screenings, heart stress tests. They make it sound like if you don't do these things immediately, you're playing Russian roulette with your health. But here's what they're not telling you, and what I wish more doctors would discuss openly with their patients. The medical landscape has shifted dramatically in recent years. Major health organizations have quietly updated their guidelines, acknowledging that aggressive screening in healthy seniors often leads to a cascade of problems. We're talking about overdiagnosis, unnecessary treatments, and serious complications that can rob you of the very quality of life these tests are supposedly protecting. Yet many doctors continue ordering these tests on autopilot, either because they haven't kept up with the evolving research, or because, let's be honest, these procedures generate significant revenue for the medical system. Before we dive deeper, I want to make something crystal clear. This conversation isn't about ignoring warning signs or refusing all medical care. If you're experiencing symptoms, bleeding, pain, shortness of breath, or anything that concerns you, absolutely talk to your doctor and get appropriate testing. What we're discussing today is routine screening in people who feel perfectly fine. That's a completely different situation, and the risk-benefit calculation changes dramatically. Here's the fundamental principle that gets lost in our test everything culture. Medical screening makes sense when the benefits clearly outweigh the risks. But after 73 critical factors shift. Your life expectancy changes how we calculate long-term benefits. Most diseases progress more slowly, meaning something found today might never actually threaten your health in your remaining years. And perhaps most importantly, your body doesn't bounce back from procedures the way it did when you were 50. A complication that would be a minor setback at 50 can be life-altering or even life-threatening at 75. So let's talk about the first test that's routinely pushed as essential, but that medical evidence increasingly questions for healthy seniors over 75. We're talking about colonoscopy screening. Now, I can already hear some of you saying, "Wait, I thought colonoscopies save lives." And yes, they absolutely can, especially for people in their 50s and 60s. But the United States Preventive Services Task Force, which is the gold standard for evidence-based screening recommendations, now explicitly recommends against routine colonoscopy screening after age 75 for people who've had normal previous screenings. Let me tell you why this matters. After 70, your risk of serious complications from colonoscopy jumps significantly. Bowel perforation happens in about 1 out of every 300 procedures for seniors, compared to 1 in 1,000 for younger folks. That often means emergency surgery, hospitalization, and a recovery that can take months or lead to permanent problems. The sedation itself becomes riskier because older hearts don't always handle it well. And that bowel prep you have to drink, it can cause dangerous dehydration and electrolyte imbalances that trigger heart problems or falls. Now here's the part that really opened my eyes when I started digging into the research. A major study followed 50,000 seniors over 75 for 10 years. Those who continued getting routine colonoscopies had no better survival rates from colon cancer compared to those who stopped screening. Read that again. No improvement. But they did have significantly higher rates of hospitalization from complications caused by the procedures themselves. Think about the math here. Colon cancer grows slowly. If you're 75 and had a normal colonoscopy at 65, any new polyp would take 10 to 15 years to become dangerous cancer. Statistically, you're far more likely to die from heart disease, stroke, or simply old age before that slow-growing polyp ever threatens your life. Meanwhile, the colonoscopy itself has immediate, real risks. I remember one patient, a vibrant 77-year-old woman who loved hiking with her grandchildren. Her doctor insisted she needed another colonoscopy. She'd had normal ones at 60 and 70, felt completely healthy, but agreed because that's what you're supposed to do. The procedure perforated her bowel. She ended up in the ICU, underwent emergency surgery, spent 2 months recovering, and never quite got back to her hiking. all to screen for a cancer she almost certainly didn't have, and that, even if present, would have grown so slowly it likely never would have affected her remaining years. Now I want you to pause and think about this for a moment. Drop a comment below with the word screening if you've ever felt pressured into a medical test when you weren't sure it was really necessary. I read every single comment, and I want to know if this resonates with your experience. The second test we need to talk about is prostate cancer screening with PSA tests for men over 70. This one is especially frustrating because the evidence against routine screening is so clear, yet it continues to happen constantly. Here's what most men don't know. Autopsy studies have shown that 60 to 70% of men who died from completely unrelated causes, car accidents, heart attacks, whatever, had prostate cancer cells in their bodies that they never knew about. Because these cancers were growing so slowly, they never caused a single symptom. These are what we call indolent cancers, meaning they just sit there doing nothing harmful. The European randomized study of screening for prostate cancer followed 162,000 men for 13 years. For men over 70, PSA screening did not reduce death from prostate cancer. Let me say that differently. It didn't save lives, but it did lead to massive increases in biopsies, surgeries, and radiation treatments, all carrying serious side effects like incontinence and sexual dysfunction. Here's the cascade that I've watched unfold dozens of times. A healthy 75-year-old man goes for a checkup. The doctor orders a PSA test automatically. It comes back slightly elevated. Now he's worried. He gets referred for a biopsy, which itself carries a 2 to 3% risk of life-threatening infection, higher in older men. The biopsy finds cancer, which it often will because prostate cancer is incredibly common in older men. Now everyone's in panic mode. He gets pressured into surgery or radiation even though that cancer would almost certainly never have caused him problems in his remaining years. But the treatment? That causes permanent problems right now. Incontinence, impotence, complications from surgery. I've sat with too many men in their late 70s who came to me after treatment, struggling with side effects, asking through tears, "Did I really need to do this?" And the honest answer, based on the medical evidence, is usually no. They treated a cancer that would have never bothered them and sacrificed their quality of life in the process. Before we continue, if you're finding this information valuable, if it's making you think differently about healthcare decisions you or your loved ones might face, do me a favor, hit that subscribe button right now. We put out content like this regularly because I believe you deserve to know what the actual medical evidence says, not just what's become routine. Don't miss out on future videos that could protect your health and quality of life. The third test is cardiac stress testing in people without any heart symptoms. This sounds so sensible on the surface. Let's check your heart, make sure everything's okay. But for healthy seniors with no chest pain, no shortness of breath, no concerning symptoms, this often opens a door to interventions you don't need and complications you definitely don't want. Stress tests themselves can trigger heart problems in older patients because you're literally pushing your heart to maximum capacity. False positive results happen 40 to 50% of the time, meaning the test shows something abnormal, but when they do follow-up testing, there's actually nothing wrong. But now you're on this train that's hard to get off. A study in the Journal of the American Medical Association Cardiology followed 10,000 seniors without cardiac symptoms. Those who had routine stress testing had no better heart outcomes than those who didn't get tested, but they did have significantly higher rates of complications from all the follow-up procedures that the stress tests triggered. Here's the typical scenario. You're 73, feeling great, decide to get a stress test just to be safe. It shows something questionable. You get rushed into cardiac catheterization, an invasive procedure where they thread a tube through your arteries. They find a 40% blockage. Now here's what they don't tell you. Many people have blockages like this that never cause problems, but the cardiologist says, "Well, we're already in here. Let's put in a stent just to be safe." Now you're on blood thinners for life, with increased bleeding risks, all because of a screening test on a heart that was working just fine. Let me share a real example that illustrates how different the outcomes can be when you make informed decisions. A couple came to see me, both in their mid-70s. Their previous doctor had scheduled them for the whole package: colonoscopy, PSA testing, cardiac stress test, calling it all essential preventive care. They were active, healthy, no symptoms whatsoever. We sat down and went through the actual medical evidence. I showed them what the major medical organizations recommend. We discussed the real risks versus the potential benefits given their age and health status. They decided to skip all 3 screening tests. Instead, we focused on what actually does improve healthy longevity after 70. They walk together every morning. They do strength training twice a week at their local senior center. They switch to a Mediterranean-style diet, lots of vegetables, fish, olive oil, whole grains. They manage their blood pressure and cholesterol with medications that have proven benefits. They stay socially engaged through their church and volunteer work. 5 years later, they're both 81 and thriving. Meanwhile, 3 of their friends from the same social circle who did get those mandatory tests have had serious problems. One ended up hospitalized for a week after her colonoscopy perforated her bowel. One lives with permanent incontinence after prostate cancer treatment for a cancer his doctor admitted was very slow growing. Another is on blood thinners after getting a stent he probably didn't need, and he's already had 2 serious bleeding episodes. Now, someone watching might be thinking, but what if the test finds something real? What if I'm the one who actually has a problem? That's a fair question, and it deserves a thoughtful answer. First, if you have symptoms, that changes everything. Symptoms mean diagnostic testing is appropriate because we're investigating a real problem. What we're talking about here is screening, looking for problems in people who feel perfectly fine. Second, we have to look at probabilities honestly. Yes, screening might find something, but the question is, will finding it and treating it actually help you live longer or better? For most slow-growing cancers and cardiac issues in people over 75, the answer is no. You're more likely to die with these conditions than from them. Meanwhile, the treatment itself carries immediate risks. Third, and this is crucial, we have to count the harm caused by screening itself. It's not a neutral act. The procedures carry risks. The false positives cause anxiety and lead to more invasive testing. The overdiagnosis leads to overtreatment of things that would never have caused problems. Drop a comment with the word informed if you're starting to see why having all the facts matters so much when making these decisions. Your engagement helps other people find this information too. Now let me address some questions I get constantly about this topic. Someone always asks, "Are you saying I should never see a doctor after 70? Absolutely not. What I'm saying is be selective and strategic. See your doctor regularly. Manage conditions you actually have. Take medications that have proven benefits for things like blood pressure and cholesterol. Get appropriate care for symptoms. But don't go looking for problems through aggressive screening when you feel great." Another common question is, what about family history? My father had colon cancer. Family history can change the calculation, absolutely. If you have strong family history of cancer diagnosed at young ages, that's a different risk profile. This is exactly why these decisions need to be individualized, not based on one-size-fits-all protocols. People also ask, but didn't you go to medical school to learn to catch problems early? Yes, and I also learned that medical interventions need to help more than they harm. Early detection sounds good, but only if early treatment actually improves outcomes. For slow-growing diseases in older adults, earlier detection often just means earlier treatment of something that would never have caused problems, which means earlier side effects and complications. Here's another perspective that might help. The Choosing Wisely campaign, which is supported by dozens of medical specialty societies, explicitly lists these screening tests in elderly patients without symptoms as examples of low-value care. That means medical care that wastes resources and can harm patients without providing real benefits. This isn't fringe medicine. This is mainstream medical organizations saying we need to stop doing these things routinely. International comparisons are eye-opening too. The United Kingdom has much less aggressive screening of elderly patients compared to the United States. Yet their health outcomes for seniors are similar or sometimes better than ours. How can that be if all this screening is so essential? It's because aggressive screening doesn't necessarily equal better health, especially in older adults. So what should you do with this information? I recommend having a direct conversation with your doctor before agreeing to any screening test after 70. Ask these specific questions. Given my age and current health, what's the actual probability this test will find something that will genuinely threaten my life in my remaining years? Make them give you numbers, not vague statements about being better safe than sorry. What are the specific risks of complications from this test and any procedures it might lead to? Again, you want numbers. 1 in 100? 1 in 10? Be specific. What would we do differently based on the results? If finding something wouldn't actually change treatment in a way that improves your life, why are we looking for it? What do the major medical organizations recommend about this screening for people my age? Many doctors haven't kept up with updated guidelines that recommend against routine screening in older adults. If your doctor gets defensive or dismissive when you ask these questions, that tells you something important. A good doctor will respect your right to make informed decisions about your own healthcare. Now, refusing unnecessary screening doesn't mean ignoring your health. Actually, it frees you up to focus on things that genuinely matter. Exercise is proven to extend healthy life and improve quality of life at any age. Nutrition matters enormously. Social connections are as important for longevity as not smoking. Managing known conditions like high blood pressure and high cholesterol with proven medications makes a real difference. The irony is that we spend enormous amounts of money and expose people to significant risks through aggressive screening, while often neglecting the basics that actually work. I'd rather see a 75-year-old walking 30 minutes a day and eating vegetables than getting every screening test under the sun while remaining sedentary and eating poorly. Let me be clear about one more thing. I'm not against modern medicine. I'm a physician. I believe in evidence-based care. What I'm against is the reflexive test-everything approach that's become standard, even when the evidence shows it causes more harm than good. I'm against the financial incentives that keep unnecessary screening going even after the medical organizations have changed their recommendations. And I'm against the paternalistic attitude that patients shouldn't be trusted with this information because they might make decisions their doctors disagree with. You have the right to know what the research actually shows. You have the right to make informed decisions about your own body and healthcare. And you have the right to prioritize quality of life over quantity of medical interventions, especially in your later years when the balance shifts so dramatically. Think about what matters most to you. Is it avoiding every possible medical problem, even unlikely ones, no matter what it costs in terms of procedures, side effects, and complications? Or is it maintaining your independence, your quality of life, and your ability to do the things you enjoy for as long as possible? For most people I work with, it's the latter. And that often means being selective about screening, focusing on what actually helps rather than what's become routine. Before I wrap up, I want to emphasize again that this is about making informed choices, not about following a rigid rule. Some people, after understanding all the facts, might still choose to get screened. That's fine if it's a truly informed decision. What I'm advocating for is the conversation, the honest discussion about risks and benefits, the acknowledgement that less medical intervention is sometimes better than more, especially as we age. If you're taking anything away from this, I hope it's this. You're not a bad patient for asking questions. You're not being difficult for wanting to understand the evidence. And you're not irresponsible for choosing to skip screening tests when you understand the risks and benefits and decide they're not right for you. In fact, you're being exactly the kind of informed, engaged patient that medicine should encourage. The healthcare system often makes you feel like a passive recipient of whatever doctors decide. But your health, your body, your decisions. Doctors can and should advise, but ultimately, you're the one living with the consequences of every medical intervention or non-intervention. Make sure those consequences align with what matters most to you. If this information has opened your eyes to a different way of thinking about healthcare in your 70s and beyond, I want you to do something for me. Subscribe to this channel right now and turn on notifications. We're going to keep bringing you evidence-based information that empowers you to make better healthcare decisions. Information that the medical system sometimes doesn't want you to have because informed patients ask harder questions and don't always go along with every recommendation. But you deserve to know what the science actually says so you can chart your own course toward healthy aging on your terms. Share this with friends and family members who might be facing these same decisions. The more people who understand that aggressive screening isn't always the answer, the more we can shift the conversation toward what actually matters: quality of life, independence, and care that helps rather than harms. Together, we can create a different kind of healthcare culture, one that respects older adults' autonomy and prioritizes their well-being over profit and protocol. Thank you for watching, and I'll see you in the next video where we'll continue this important conversation about taking control of your health in your golden